Assessing appearance and mental status. Introduce selves and verify client's identity to be sure that you are administering the procedure to the right person. Good day, ma'am. I'm Hardy Torres from Batangas State University and your student nurse for today. Before anything else, may I know your name?
I'm Shen.
And how would you like me to call you?
Shen.
Explain the procedure to the client and discuss how the result will be used to lessen anxiety and apprehension of the client and gain cooperation. So, Ma'am Shanali, this mental status examination can help to distinguish mood disorders, thought disorders, and cognitive impairment, and it can guide appropriate diagnostic testing and referral to a psychiatrist or mental health professional. Perform hand hygiene and observe other appropriate infection prevention procedure for infection control. Provide for the client privacy to show respect to the client. Ma'am Shanali, this room is free from any distraction. The door, windows, and the curtains are already closed for your privacy. Observe for the sign of distress in posture and facial expression. So, upon observation, I found no distress. Observe for the body build, height and weight in relation to the client age, lifestyle, and health. Ma'am, may I know your height and weight?
155 centimeters and 68 kilos.
So, it's proportionate and varies with lifestyle. Observe for the client's posture and gait, standing, sitting, and walking. Ma'am, can you please stand and then sit? How about walking at least 3 steps away from me? Okay, now you can go back. How about raising each of your hands sideward and forward? Thank you for that, ma'am. You may now take your seat. So the patient is relaxed, in erect posture and coordinated movement, which is good and normal. Observe for the client overall hygiene and grooming. Ma'am, may I ask how many times you take a bath per day?
1 to 2 times a day.
How about your teeth? Any broken teeth or pain? So it's neat and clean and the patient is in proper grooming. Note for the body and breath odor in relation to the activity level. So the patient is, there's no body odor relative to the work or exercise and no breath odor. Note obvious sign for health or illness. So the patient is well developed, well nourished, had an intact skin, and no difficulty of breathing. Assess the client attitude. So the patient is well cooperative and able to follow instruction. Note for the client's affect or mood. Assess the appropriateness of the client response. I observe that the patient is precisely understandable and the answer are appropriate to situation. Now I'm going to listen for the speech quantity and quality. So upon listening for the patient speech, it results to be understandable, moderate pace, and clear tone inflection. Listen for the relevance and organizational of thoughts. Ma'am, may I know your birthday?
August 12.
Can you state the day today?
It's Saturday.
So the patient answer is makes sense and it has sense of reality. Now I'm going to document findings for the client records to serve as baseline data for healthcare provider. Assessment of external female genitalia and inguinal area. Gather all the equipment needed to promote efficiency of healthcare procedure. So the equipment that will be used in this assessment are the clean gloves, the drape, and supplemental lighting if needed. Introduce selves and verify client's identity to be sure that you are administering the procedure to the right person. Good day, ma'am. I'm Hardy Torres, your student nurse for today and from Batangas State University. For the verification first, may I know your name? How would you like me to call you? Okay. Explain the procedure to the client and discuss how the result will be used in planning further care or treatments to lessen anxiety and apprehension and obtain client's cooperation. So, ma'am, this assessment of female genitalia is important for all women as it reveals many disorders for the reproductive organs, lower urinary tract, and lower abdomen. Perform hand hygiene and observe other appropriate infection prevention procedure for infection control. So, ma'am, let just me put my gloves. So provide for the client privacy to show respect to the client. So ma'am, this room is free from any distraction. The doors, window, and the curtains are already closed for your privacy. Now inquire about the client history related to female genitalia to ensure accurate health assessment. So ma'am, do you have any history of regularity of menstruation cycle? Incidents of pain during intercourse if ever? Vaginal course discharge? Urgency and frequency of urination at night? Blood in urine? Painful urination? How about incontinence history of sexual transmitted infection, past and present if ever? Okay, thank you for that. Now, cover the pelvic area and place the client on a supine position to provide privacy and comfort. Inspect the distribution, amount, and characteristic of pubic hair. So distributed in the shape of an inverse triangle, clear with normal hair distribution. So inspect the skin of pubic area for parasite, inflammation, swelling, and lesion by separating labia majora and labia minora. So, now, ma'am, tell me if you feel uncomfy, okay? So the patient pubic skin is well intact, no lesion. It is slightly darkened. Labia is round, full, and relatively symmetric. No nits and lice, and there's no inflammation, swelling, or discharge. Now I'm going to inspect the clitoris, urethral orifice, and the vaginal orifice when separating the labia. So the patient clitoris does not exceed 1 centimeter in width and 2 centimeter in length. The urethral orifice appears as small slit and is the same color as surrounding tissues. Now I'm going to palpate the inguinal lymph nodes. Ma'am, again, tell me if you feel uncomfy, okay? So no enlargement and tenderness. Now I'm going to remove and discard gloves and perform hand hygiene. It is for infection control. Document findings in the client record to serve as baseline data of healthcare provider. Thank you for your cooperation. In addition, if ever the patient have abnormal external female genitalia and inguinal area, findings may be scant pubic hair that may indicate hormonal problem, hair growth extend over the abdomen, and there's a presence of lice, lesions, scars, fissures, swelling, erythema, excoriation, varicositis, or leukoplakia. There's also process of inflammation, swelling, or discharge in pubic skin, and the inguinal lymph nodes may be enlarged and has tenderness. Thank you.